Hi guys, Tina here. I just wanted to do a quick update. I've just come back from my normal doctor, not my fertility specialist, and I've gotten the results of a blood test I had done, which is called an HLA status. So it was just to see whether I carry the kinds of genes that people with celiac disease have. And the reason that I ran this test is just simply because I don't digest gluten well. And even though I have celiac screens run through blood tests and they come back negative, it may have been because I wasn't eating enough gluten at the time. I went to a dietitian last year and they suggested that I get the HLA status run just to see, and then I can know whether I might be or might not. So the genes that I've come back with, 90% of people with celiac disease have these two genes. So it's likely I do have it, but the only way to really get it checked out properly is to go to a gastroenterologist and then have a gastroscopy, I think, with some kind of biopsy. I'm not going to do that just because I've been to so many different specialists lately with this TTC journey thing that I'm just not going to do it. And if at the end of the day it's just go gluten free, I'm happy to try that. But I know that the advice is that if you're not gluten intolerant or celiac, going gluten free is actually a bad thing. But back on the celiac thing, the interesting thing about that is that some people with celiac disease can actually have issues with infertility, and some people can have issues with miscarriage as well. So for me, maybe gluten-free is a good idea. I don't think it's going to be the solution, but I think it's worth giving it a go as an extra form of sort of positive treatment for me personally and my particular situation. And yeah, so I'm going to try that. And what was I going to say about that? So I will do a little bit of a vlog on what I'm going to be doing gluten-free wise. I always avoid PCOS trigger foods when I'm TTCing particularly. I try to all the time, but when I'm definitely TTCing and when I have been for the short time pregnant, just like avoiding alcohol and shellfish and everything else people avoid, I also want to try and avoid, sugars and all of those sorts of things, like I'm sure everybody does with PCOS when they're TTCing. And so the other thing now is getting rid of gluten out of my diet completely, because something to do with when you eat gluten, you're intolerant to it. Your intestines, you can't absorb through your intestines the nutrients you want to as efficiently somehow. I'm not sure how it works. If anyone knows, I'd be fascinated to hear. So yeah, that can subsequently rob yourself from the absorption of particular nutrients, and then obviously your pregnancy and your baby. And I think that that's how maybe that has to contribute with the miscarriage factor as well, is just a lack of nutrition. So yeah, it'll be interesting to see if anyone's PCOS with celiac and trying to conceive. I'd love to know what you do or anything, any little sort of tips and tricks. Yeah, I've just come back from the dentist, so I apologize if my face looks a bit funny because one side is actually numb. But anyway, that's a side issue, and I will check in with you guys soon.